Hey health fanatics, and welcome back to Daily Health Tips. Today we're tackling a topic that's not just important, it's life-saving. We're talking about stroke. Now, you might have heard the word stroke before, but do you really know what it means, what it looks like, and more importantly, what to do if you or someone you know is having one? Because folks, when it comes to stroke, every single second counts. So, what exactly? A stroke? Think of your brain as the supercomputer of your body. It needs a constant supply of oxygen and nutrients, delivered by blood. A stroke happens when that blood flow to a part of your brain is interrupted and oxygen flow to the brain. This occurs as a result of the blood vessel feeding the brain getting clogged or bursting. This interruption can happen in two main ways. Either a blood vessel gets blocked, that's an ischemic stroke caused by blood clots and the most common type, or a blood vessel ruptures and bleeds into the brain. That's a hemorrhagic stroke caused by bleeding. Both are incredibly serious and can lead to brain damage, disability, or even be fatal. Stroke kills twice as many women as breast cancer every year. But here's the good news. Recognizing a stroke quickly can make a massive difference. And there's a super easy, memorable acronym that can help you remember the key signs. It's called FAST. Let's break it down, using some of the key symptoms listed. F is for face drooping. Ask the person to smile. Does one side of their face droop? Is their smile uneven? This is listed as sudden numbness of the face, i.e., face drooping. A is for arm weakness. Ask them to raise both arms. Does one arm drift downward? Do they have trouble raising one arm at all? S is for speech difficulty. Ask them to repeat a simple phrase. Is their speech slurred? Are they having trouble finding words or understanding what you're saying? T is for time to call emergency services. If you see any of these signs, even if they seem minor or go away, it's time to call your local emergency number. Just immediately. Don't wait. Remember, even if the symptoms disappear, it could have been a mini stroke or TIAA, transient ischemic attack, which is a serious warning sign for a full-blown stroke. So, never ignore it. While the FAST acronym is about recognizing symptoms, it's also crucial to be aware of the risk factors for stroke. Prevention is better than cure. Things like high blood pressure, diabetes, high cholesterol, smoking, obesity, and an inactive lifestyle can all increase your risks. Taking steps to manage these can significantly reduce your chances of having a stroke. There are some great foods to prevent stroke like beans and other folate-rich food, oats, almonds and soy, and fruits and vegetables as good antioxidants. Also, foods rich in potassium, low-fat milk, salmon and other fatty fish. Magnesium-rich food like barley and cornmeal are beneficial, and remember to limit salt. We've covered the basics, but let's dive a little deeper into treatments. When emergency services arrive, they'll be looking to confirm a stroke and determine its type. Why is that important? Because treatment differs. Several stroke treatments include aspirin, intravenous injection of TPA, which are clot-busting medications, and even mechanical clot removal for ischemic strokes. For hemorrhagic strokes, the focus is on controlling the bleeding and managing brain swelling. Sometimes through procedures like carotid endarterectomy, angioplasty and stents, or surgical blood vessel repair. The faster the diagnosis, the faster the appropriate treatment can begin and the better the chances of recovery. And what about recovery? Stroke recovery is a journey, often involving rehabilitation therapy like physical therapy, occupational therapy, and speech therapy. Every stroke is different, and so is every recovery. But with early intervention and dedicated therapy, many individuals can regain significant function. Remember, proactive health management is key. Regular checkups, a balanced diet, consistent exercise, and avoiding smoking and excessive alcohol consumption are your best defenses against stroke and many other chronic diseases. So next time you or someone you're with exhibits any of the FAST signs, you'll know exactly what to do. You'll be a lifesaver. We hope this information empowers you to take control of your health and be prepared for anything. If you found this video helpful, please give it a big thumbs up. And if you want more vital health tips, actionable advice, and deep dives into making healthier choices, make sure you hit that subscribe button and ring the notification bell so you never miss a Daily Health Tips video. Until next time, stay healthy, stay informed, and stay safe. See you in the next one. Disclaimer. The information provided in this video is for general informational purposes only and does not constitute medical advice. It is not a substitute for professional medical diagnosis, treatment, or advice. Always seek the advice of a qualified healthcare professional with any questions you may have regarding a medical condition. If you suspect someone is having a stroke, call your local emergency services immediately.